This episode of Fertile Talks is sponsored by ILMeds.co, an international mail order pharmacy specializing in fertility medications. If you're looking to save significantly on your fertility treatments without compromising on quality, ILMeds.co is an excellent choice, offering up to 80% of retail prices. And as a special offer to our listeners, use the code FT24 at checkout to receive a $50 discount on your order. For your convenience, you can find a link to their website in the episode show notes. Thank you, and let's get started. Welcome to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks. Hello, everyone. This is Dr. Famuyiwa with Fertile Talks. And today we have someone special that is going to be helping us with fertility today. We have Dr. Stephanie Fein. She focuses only on fertility and weight loss, and that is a big thing to deal with nowadays. So it's really nice that we have someone who specializes in this particular area to help our patients. So, Dr. Fein, I want you to tell us a little bit about yourself.
Lovely. I would be happy to. I'm so happy to be here. I am, as you said, I'm Stephanie Fein. I do weight loss for fertility. So that is all I do. And the reason that happened, I'm actually an internist, and I was helping people with weight loss because prevention is my favorite way of treating anything is preventing it from happening. And weight loss is so helpful for so many parts of our health.
Right.
And then I went to a conference and I hadn't known this. I found out that it helps fertility. I was blown away. I knew it helped diabetes and heart disease and everything else, but I did not know that it impacts fertility. And to me, that was everything. I myself had a rough start to motherhood. My first kid came at 24 weeks and he's doing great now, but it was rough. And so everyone who's having a rough time, I have a soft spot in my heart. So I love the combination of working with people who are going to be parents and weight loss.
Excellent.
So I'm happy to be here.
Excellent. So, Dr. Fein, let's see, what is the connection between someone's weight and their fertility?
And these are done with studies, right? So, and I always like to say that because it's groups of people. So everyone is an individual and we always have to work with that. But when we also get data that informs the decisions that we make. And so it looks like weight impacts, the higher the BMI, the more risk there is involved in both egg retrievals and getting pregnant, and then also during pregnancy.
Awesome.
And the mechanisms we don't know exactly, but we're getting clues as time goes on and we do study them. And it looks like it's an endocrine, a hormone issue, and also inflammation, which really can end up being a hormone issue. But that there's things like fatty acids that end up being lipotoxicity in the body. And in fact, in follicular fluid, they find some, so that there's some damage that can happen with.
I'll explain it better to our audience, right?
Great.
Some of them may not know lipotoxicity.
Yeah.
When the fat cells themselves become toxic to the body, that effect is called lipo fat cell toxicity, correct? Okay.
Exactly perfect. Yeah, that was amazing. So it, precisely that, and we don't necessarily know exactly how that happens, but we see that there are the fatty acids and there's a irregularity in the cells, and so we're making some connection there.
Excellent.
There's also from the fat, this is in my career lifetime, finding out that fat is actually an active tissue.
Mhm.
So we used to think it was just inert, like it's just storage and it just sits there. But it actually has, as you were saying, it has roles. It does things. And so it affects insulin. It also is a place for leptin to come. Like there are
So
hormones that are
yeah,
created from the fatty tissue.
I want to dive into the leptin a little bit more, but before I
Yeah,
talk about that, we do know that both extremes of the weight spectrum can have fertility issues. Do you want to
correct.
comment a little bit about that? Too
Yes.
little?
There's a U shape, exactly. If you have too low of a BMI, and I use BMI because that is what the studies have used. So that's whether it's a great
Your body
indicator.
mass index, right?
Exactly, the body mass
Pounds
index.
to how tall you are.
Correct.
Yes.
And there's some controversy about whether it's a good measure, but for now that's the one we have in the studies, so that's why we end up using it. And the I don't love this verbiage, but the normal um, uh, um, numbers is between 19 and 25. So anything lower than 19 and anything above 25,
Mm.
25 to 29 is considered overweight. That's the category name. And then above 30 is obese. And there are different categories of that.
Okay.
And in the lower than 19 and above 25 is when you start to get changes in fertility. So it does look like the body cares
Mhm.
um, of the weight, that the weight impacts
So
it.
some of these changes in the two extremes can cause problems with a woman's menstrual cycle, can it not? Interfere with the
Exactly.
brain signal to the ovary. You want to comment on that a little bit?
Yes, it looks like one of the mechanisms is insulin. So you may have heard, I mean, the people listening may have heard about insulin resistance, which is something that comes before diabetes, type 2 diabetes, which is very prevalent when with higher body mass indexes. And the insulin resistance ends up meaning that we have extra insulin, that
Yeah,
we need higher amounts of insulin in order to affect
the
the
same.
change that we need, and because we are resistant to it. And that increase of insulin causes issues. And specifically for fertility, it causes issues with testosterone and
Yes.
liver and the different amounts, and especially with sex hormones, the balancing of the hormones is what's important. The amount we have compared to the other things, and that can be off balance
And we
when
did
our
know that.
insulin is off.
Yeah,
Yeah,
because we know that excess insulin is also associated with elevated androgen levels, which are the male hormone type pattern, and cause what is called the metabolic syndrome. So,
that's it.
can you comment on the metabolic syndrome? And then we're going to talk a little bit about the effect of in those patients that have excess weight loss. The mechanism is different than low weight ones. So we'll talk about that and how does the weight loss translate to fertility?
Yes. So you said that perfectly about the androgens, and that usually ends up being the issue. And so, wait, my brain just went to how it helps. So what was the first part of the
The
question?
question is, so we talked about how weight loss can truly improve fertility.
Yes.
What would be the mechanism of
Oh
that
yeah.
loss translating into?
It rebalances. So a couple things. We talked about how the fat itself has an endocrine function, and so we have less of that. And also, it's fat itself, the tissue can be pro-inflammatory, meaning it makes more inflammation in the body.
Which we know
Everywhere it is.
is destructive to the eggs and sperm, right?
It,
Inflammation destroys the egg.
absolutely. Absolutely. And that's a really important point, actually, because people don't often talk about that,
Yeah.
but it's really true. And so whenever we're decreasing the tissue, decreasing the fat tissue, then we're decreasing the effect that it's having on the body. And this is my favorite part. And this is what I learned originally. And it's so important. 5% weight loss makes a difference physiologically,
So,
which is such good news because 5%, like people don't have to lose 100 pounds. They don't have to even lose 50 pounds. If you're 250 pounds, if you lose 15, 13 pounds,
mhm.
you're making a physiologic difference. And the studies have shown that oftentimes ovulation will return if it had been deranged, you weren't having ovulation regularly, that it's possible to get it back with 5%.
Excellent.
And that to me is just a beautiful thing. I always think of it like the body wants to help, right? We give it a little help, it'll give a little help.
So what are some of the effective ways to lose weight, and comment a little bit about the types of diets out there,
Yeah.
keto, Mediterranean,
Yes.
intermittent fasting. What gives with all of this?
Yes. Oh, it's such a good question. So, what I care about most, as I alluded to with the prevention, it's so important to me that when we lose weight, we lose it forever.
Mhm.
Because losing it for a month and gaining it back is not ultimately helpful, particularly in the population of people who want to get pregnant and then stay pregnant. So we can't do something drastic that isn't healthy for our body and then stop it and then gain lots of weight during pregnancy because we're at risk. So it's so important to learn something. And what the way I think about it is change our relationship with food so that it feels very easy and normal to eat in a way that has us losing weight and keeping it off.
Okay.
And in order for that to be the case, we have to almost ignore everything that's out there. And this is the problem, is that there's a what I call a diet mentality, this idea of forcing and restricting and changing things so dramatically and punishing ourselves in order to do it.
Right.
And the problem with it is that it works. And I put that in air quotes because it temporarily works.
And then you get
But as most people know, if we've done that and maybe we've lost some weight and that part feels good, but then very soon after, we not only do we gain it back, but even plus some.
yes.
And the bigger piece to me is that we've also damaged the relationship with ourselves because we've punished and restricted and made it very difficult on ourselves. And that doesn't serve us long term. So the vision to me, it has to be long term. We can't be looking at a 2 month, race. It
Yeah.
has to be a
Yeah.
marathon.
So, what makes weight loss particularly challenging, and what's the impact on stress, weight loss, and fertility?
Yes. So the what I think makes it challenging is this aspect that I've just said, meaning people think that that's the only way to lose weight.
Okay.
Is this very hard? And like you had mentioned, keto and fasting, and these things are very hard on us mentally, and especially people who are going through fertility. It's not easy.
So
There's a big
there's
mental
got to
load.
be some element of a mindset change.
Yes. And the way that I start it is with what I call the hunger scale. And what I mean by that is we start to change, to listen to our bodies and know and feed it when it's hungry and then not eat when we're not hungry.
Mhm.
And it sounds very simple.
So
But we
how
get
does
so
that,
many
yeah,
we get so many messages
to eat?
to eat, right? From television commercials and our family and restaurants and I mean, it's so interesting. So when we really tune in, it starts to make a lot of sense.
And also, I mean, some people say that our reset button for where satiety is has somehow changed. So
Uh,
how can we what is the role of the GLP-1 agonists like, Ozempic and Wegovy and
yeah.
Mounjaro? How do they come into play with it?
So it's a really interesting and sort of it's an exciting new medicine, that's for sure. And my experience with it in general, the main thing is there's not great studies
Right.
about pregnancy and the medication. So
Sure.
that right now the recommendation is to stop 1 to 2 months. It was 2 months before transfer, before conceiving.
Mhm.
Um, there are animal models that show uh, uh, problems, unlike teratogenic issues. So the developmental
It's
problems, and it's
kidneys,
with bones, muscles, and later in the pregnancy, it's kidney issues.
but they were given super physiologic doses, right?
Not the rats. They were given the amounts
Yeah.
that they take now for weight
There's a
loss.
potential for toxicity
In animal models.
in animal models.
So there have been teeny little studies of people who, got pregnant by accident and didn't
Okay.
realize, and they haven't shown um,
So
malformations,
mm.
which is one category.
So they cut the recommendation down from 2 months to like 1 to 2 months.
Well,
So
still, it's officially 2 months,
right.
but in practice, it looks like some people are doing 1 month. And of course, the question is about retrievals because there's no studies on that.
Yeah.
The companies are doing studies on pregnancies because of the fact that people are getting pregnant on it,
Yes.
and that data will be out in 2027, end of 2026.
Can't wait. Can't wait to hear that. That's
Yeah, it'll be very interesting. Now, but the issue with, I will say, the issue with the medications are a couple things. One, the question of whether you can have it during pregnancy. But when you stop using it, you gain the weight back. And this is the issue with everything.
Mhm.
And so for some people, it will make sense to have it for the rest of their lives. And for some, it won't make sense. So to me, we never get away from learning how to listen to our hunger cues because it does the medication can makes you less hungry. I mean, you literally feel full very quickly.
Mhm.
But learning to pay attention to that is the same as learning to pay attention to it when you're not on medication.
Yeah. So you have to learn new skills, new lifestyle habits. So you have to, I guess, change that satiety range, which the medication helps you change, but now you need to now put in place things to maintain it, right?
Exactly right.
Mhm.
Exactly right. And the good news to me is there are ways to do that. One of the main things is if we wait too long to eat, so
Right.
if we get very hungry, it's almost impossible to stop at
Mm.
a typical a usual size meal. We will overeat. So it's not only stopping eating too much, it's eating when we're hungry so that we don't wait too long and then need to eat a much bigger meal. So there's really a lot with the hunger scale.
So training your stomach to say, hey, listen, eat so much, then stop, and then we're okay with that, and that feels good.
Yes.
Then you start to do more of it, and then you
Yeah.
keep doing more of it because now you've changed your brain system on the inside. Correct?
Exactly. And while you're doing that, you notice, oh, I'm eating when I'm not hungry. Why am I doing that?
Yeah.
And then you realize, oh, it's because I was bored, or oh, it's because someone gave me this. Like there starts to be reasons, and then you can investigate, and you change the way you think about food.
Excellent. Now, another question that people talk about is what would be the types of food that would
Yeah.
be most helpful?
Yes, it's such a good question because you're right. People do ask, and it's um I have a couple ways of thinking about it. One is there's never a magic bullet. It would be amazing if I could say, yes, if you have 3 cups of kale and 1 avocado, you'll get more eggs. I mean, I wish it was like that, but it just isn't.
Mhm.
The way that I generally like to look at it
Yeah.
is I think the decrease in fat tissue
Mhm.
trumps and any kale. Do you know what I mean? Any particular thing. And so what I mean by that is that weight loss ends up being a bigger factor. And if someone can lose weight by eating what they like, but just less of it, that's going to end up helping us long term rather than saying you can only eat, a walnut and and these sorts of things. Now, are there better foods than others? 100%. But what I don't want is for someone to go from one way of eating to this drastic other one because they will likely, rebel on themselves or stop doing it. But in general, whole foods are fantastic. So things that are not processed are always going to be better choices. Colorful things like fruits and vegetables, getting good lean proteins always is going to be a good way to go.
Now, I don't know if you're familiar with this, but do you see a lot of, of course, America is the big melting pot, and you probably have clients from different continents, right? So, maybe Indian or African
Yeah,
or South American. And how does that play into the type of dietary recommendations? Because they'll say, I want to eat what I've always eaten since I was
exactly.
a year old.
100%. Actually, it's so interesting. I work on the phone, so I don't always it doesn't matter. And here's what I mean by that. I like people to eat what they like to eat. I do think that that is helpful, especially when we're changing the relationship to hunger and satiety. And then what happens as we're listening to our bodies more, because we're listening to when we're hungry and when we're satisfied, we're also noticing, oh, I feel sluggish when I eat this meal. And oh, I'm energized, or I feel I have so much more energy when I eat this meal. And it starts to just make sense. Like no one has to even say anything. You're just like, oh, I prefer to have this lunch because otherwise I want to take a nap.
Yeah, that's really
So yeah,
insight, right? To pay attention to your body
yeah.
based on what you've just eaten.
Yes. And it starts to make so much sense as we're paying attention. We're like, oh, it really I notice it because we're so busy and there isn't a reason, a push to pay attention to our bodies. In fact, there's a bigger push to not pay attention, particularly in medicine. I know you can we're taught to not
Yeah.
listen, not
This is,
don't pee, don't sleep, don't anything. We're taught to ignore it. And so it's such a big deal to start to pay attention.
it's like taking mindfulness to another level. I mean, this is like, yes, spiritual mindfulness, but mindfulness of your body, like
Yes.
really listening to the senses. Hard to do, not
Yeah.
easy,
It's a
but
training though. It's all it is practice.
yeah. But even just to let people know that you can actually listen to your body after meals. Now that's a thought, right? Like journal down how you feel about certain things. If you're going to eat something that's going to keep you up all night and maybe you don't need to eat that thing that's
Or give you heartburn.
yeah, it's going to burn a hole through your
Yeah.
stomach or you feel
Yes.
so bloated, you can hardly breathe. That's
Yes.
really wonderful to have people because I'm all for people journaling and writing down to become more mindful of how their body feels after what they've eaten,
Yes.
and not only how their body feels based on what they've eaten, but how their body feels based on their satiety level, right?
Exactly. Exactly. Can you do what you want to do after you eat? The reason we eat is for fuel. It's to energize us. So we ideally we have this amazing life that we love and we're just giving ourselves enough fuel to be able to go to the next thing. And and once we have a taste of that, once we have a taste of, oh, I don't feel bloated or tired, we often want to keep it going. So then we figure out ways to make that happen.
Mhm. Very good, very good. Well, this has been very enjoyable, Dr. Fein. You bring a different insight to the nutrition aspect of fertility. We have a lot of patients who are struggling with this, very, very common. And a lot of them are turned back from treatment because we talked about all the possible complications. And
Yeah.
then these people still need, and want to be able to procreate. And everybody should have that right to be able to procreate. So that's been very helpful. Any last minute thoughts for our patients?
I I think people going through fertility are amazing. I mean, to go through it is so challenging that I want people to be able to have a loving relationship with themselves. Giving themselves grace about it all is to me the most important. And that's what this way of losing weight can give you is paying attention and not being harsh with ourselves, but making progress, just continuous progress along the way.
So tell me, Dr. Fine.
Yeah.
So now we have some patients who think, you know what, I need to talk to Dr. Fine. I need to get a hold of her. Maybe she needs to help. Where can they find you?
On my website is the best place, stephaniefeinemd.com or weightlossforfertility.com. It'll send you to the same place. I'm also on Instagram at stephaniefeinemd.
So Dr. Stephanie with a PH, Stephanie Fine,
Yep. And Fein is Fein.
Fein.com,
Yep. Yep.
or on her Instagram handle, or Weight Loss for Fertility, folks. Search it up.
Yeah.
Weight Loss for Fertility. And we'll
Yeah.
try to leave some of her contact information in the show notes.
Amazing. Oh, I just realized I also have I have a podcast called
Awesome.
Weight Loss for Fertility.
That's
Yeah.
an
And
awesome podcast. Please,
yeah,
everybody, when you get done with this, go look up her podcast. It might be able to shine some light on some issues for you. Weight
exactly.
Loss for Fertility, the podcast and the website, right?
Yes,
Fine.
that's right.
Thank you so much for taking the time. I'm so grateful for spending some time with us. And ladies and gentlemen, if you have found any value in this, we would like you to drop a comment, hit subscribe, and like us, because this is how the algorithms shares that information. And it helps us to continue to bring wonderful specialists like Dr. Fine to meet you and share some insight. Thank you once again, and have a good day. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.